We are excited to welcome you back to the Fall 2022 series. If you've attended the Thrive program before, welcome back. If you are new to the series, we are so happy to have you here. We had a great session last week, and I'm so excited to kick off session 2. If you are new to the Thrive series, it is a collaboration between mHealth Fairview and the Masonic Cancer Center at the University of Minnesota. And it is our intention to bring educational programming to anyone who has experienced a cancer diagnosis around the concept of cancer survivorship. Tonight, we will hear from Renata Braudy and Carrie Macosky. Macosky, so sorry if I butchered that. So they are two rehabilitation specialists at mHealth Fairview. Renata and Carrie will review lymphedema and discuss important strategies for treatment and management of lymphedema. We will be recording today's session and every session so that you can refer back to the recording on our website, which is going to be posted to z.umn.edu/Thrive series. As a final reminder, the chat and mute buttons have been disabled to protect the integrity of our program. So please take a moment, and let me actually just change my slide, but take a moment to locate the Q&A feature, because during tonight's presentations, please use the Q&A feature to submit your comments, reactions, and questions that you have for Carrie and Renata. At the end, Carrie and Renata will be available to answer questions that are submitted during the presentation. All right, so without further ado, I will now hand it off to Renata, who will take it away.
All right, thank you. Let's see if I can figure out this share screen. Here we go. And
perfect. It is up and running.
It is. I was trying to get rid of that screen on top. Excuse me for just, there we go. Okay. So thank you all for coming and spending an hour with us. Hopefully you'll learn some new things and get some information, and we're happy, like they said, to answer questions afterwards. So lymphedema, what you need to know. So I'm Renata Braudy. I'm a PT physical therapist for about 20 years. I'm a certified lymphedema therapist and a board certified orthopedic clinical specialist. So I do other stuff with shoulders, et cetera. And I'm actually getting my PhD currently at the U of M, looking at shoulder function after breast cancer treatment. I'm working in private practice at Motion, which is in Minnetonka. And I was working at mHealth Fairview prior to that. Carrie is a phenomenal OT with, I think, about 20 years of experience, also at mHealth Fairview. And so we split this talk into 2 pieces. These are our objectives. This is what we're going to cover today. And it's, we have about 20-25 minutes each. So it's going to be a little bit quick. I'm happy to answer questions, obviously, afterwards. But we just want to go over what is lymphedema, what are your risk factors for lymphedema, how you can reduce your risk, and importance of early screening and treatment. Those are my 4. And then Carrie is going to continue on with some of the more lymphedema treatment and education. So I wanted to start it off. I asked a bunch of my patients and then also queried some people, some of their therapists I know around the nation, about what, if they had a chance to talk to survivors, what would they want to know? Because I think we can sit up here as professionals and say everything we want, but it really comes to what patients think. So I recently had a patient who had a surgery that would be what we consider low risk for lymphedema, so not many lymph nodes out. She said, I can't count the number of times I was told I was at low risk for lymphedema. Don't worry, everyone said, as I asked how I could be proactive. I understood the impulse to reassure, but that label low made me feel sheepish about seeking preventative care. And later it echoed in my mind for months, making me doubt the early signs I was seeing. And she is now being treated for lymphedema and wears compression on a daily basis. And we'll see how she progresses because she still is in the early phase of treatment. A lot of patients tell me that they think it's just going to go away. I've had many patients also say it's worse than the cancer, as everyone can see it. And I'm reminded every day as I put on my sleeve that there is no cure for lymphedema, although they are working on it. Another patient said I did not have pre-surgery treatment analysis of my arms and trunk. It sure would have been helpful to see what my starting point was as I began developing symptoms. And to that point, some insurances are starting to pay for pre-surgical assessment, not all do. So if that's something that you are interested in, you want to tell anyone else about, I would encourage you to check insurance first. But we're always happy to see you. And then another patient said, I wish someone had told me about PT earlier. Why was I not referred until after my reconstructive surgery when it had already set in? This patient was literally crying in her doctor's office because it was so painful. Her breast was swollen and her arm was swollen, and her crying was what prompted the referral. I wonder who should have told me sooner. So what is the lymphatic system and what does it do? It is a network of vessels and organs. It runs and helps out the circulatory system with the arteries and veins. What we're mostly concerned about is how it maintains fluid balance, as that was what leads to swelling. It has some other functions as well, like immune and the absorption of fats and proteins. We have about 600 to 700 lymph nodes throughout our body. And again, what those lymph nodes do is they're part of a complicated network to help transport fluid out of the areas to prevent swelling. The lymphatic system is part of our general circulation. We all know that the arteries bring blood from the heart to the body, and veins bring blood back to the heart. But what happens on a smaller capillary, which is a very, very small blood vessel level, is some fluid goes into the tissues between the cells. We call that interstitial fluid. And all of that fluid is picked up by the lymphatics. So lymphedema happens when there is a disruption to that lymphatic system, whether lymph nodes are removed, as in this, what is lymphedema number 2? Lymph nodes can be removed or damaged or even have cancer in them. There's also sometimes scarring and other things that can affect lymphatic flow and cause or contribute to swelling. So lymphedema is actually a swelling that's caused by the accumulation of that protein-rich fluid, which is not able to be picked up back up by the veins when the lymphatic system is injured or blocked. Some people are born with primary lymphedema, and that's not what we're talking about tonight. We're talking about secondary lymphedema, which is injury to the lymphatic vessels or nodes, and that's what can cause that backup of swelling. So the picture on the left, if you look at her right hand, which is actually on your left, so it's a little confusing, the veins and tendons of the back of her right hand are not as visible as the tendons and veins on her left hand, which is on your right. She has some swelling of her right hand, for which we treated her and got some compression, and she was doing pretty well. This picture on the right, I'll give credit to Carrie. So thank you, Carrie, for a picture of lower extremity swelling. And at this point, I'm not treating lower extremity, which is why Carrie's talking about that. So where can it occur? You can get lymphedema anywhere in your body, but it depends on where those, let's say, for example, lymph nodes during surgery are removed. So if you had surgery for prostate cancer or pelvic area cancers, and let's just say you had lymph nodes removed in your right groin or right inguinal area, these lymph nodes drain within these red lines. These are called tributary regions. So each group of lymph nodes, you can see in your right groin, right armpit, left armpit, the bottom of your neck. These are simplified, of course. But let's say you had lymph nodes removed in the right groin. Well, anywhere in this tributary region, which is under your belly button to your midline and down, so your lower abdomen and your leg, as well as some of your genitals, can have swelling. If you had lymph nodes removed in your right armpit from breast cancer surgery or from melanoma or anything else, the area at risk for swelling is not just the right hand and arm, which everybody thinks about when they think of breast cancer related lymphedema, but it's also very common to have swelling in your right trunk or your right breast or chest wall, because their tributary region is under the collarbone to the sternum, to the belly button, front and back. All of that drains to these lymph nodes. So there are 4 stages of lymphedema. Carrie, I believe, will talk a little bit more about this. Stage 0 means that you've had lymph nodes removed and you might not have any active swelling. Stage 1 is reversible, meaning that we still have the ability to get rid of that swelling. Stages 2 and 3 are more advanced, where proteins are present in those areas between the tissues and cells, and the tissues feel thicker, and it's much, much, much harder to get rid of that swelling. Our goal, as I started stage 0 and stage 1, is to intervene as early as possible. We want to see you when you're stage 0. We want to see you when you're stage 1, because then we have the best ability to reduce the severity of swelling. And in some cases, reduce your risk of chronic lymphedema, so you may or may not need compression. I'm just going to emphasize, we cannot prevent lymphedema at this point. We can just reduce your risk. So how do we diagnose it? Typically, we use a tape measure in clinic, as shown here on the picture on the left. We do what we call circumferential measurements, where we measure around your arm or leg or your head and neck. If it's an arm or a leg, we can compare sides, and we plug it into a calculation that lets us figure out the volume of your arm or your leg. We can then compare that to your pre-surgical values, if we know that, or to the arm or leg which is not involved. And then we can see if one side is bigger than the other. If there's a greater than 5%, definitely greater than 10% volume difference between before and after surgery, or between your affected or unaffected side, then we're going to get you into lymphedema therapy, which Carrie will talk more about. This fancy looking scale, very expensive scale on the right. This one is called SOZO with LDEX. And this is made by ImpediMed. And what it is bioelectrical impedance. And what that is it measures body composition based on the rate at which a small electrical current travels through the body. Body fat causes greater resistance than lean mass, and that slows the rate at which the current travels. So essentially, if we got measurements, again, before surgery or after surgery, we're able to tell earlier, and I'll discuss this in the research section, if you have an early onset of lymphedema. It is promising to see some med tech companies come into this space. I believe we can make a lot of progress. This is a group from Johns Hopkins. They're actually biomedical engineering students, and as one of their projects that has taken off, they made this little device, which is originally made for IV infiltration detection, and their goal is to give patients something that they can measure at home and use at home independently, to see if there's some swelling going on. Again, the earlier we catch it, oftentimes the better the prognosis. So this is one way to put more power into each of you, instead of having to come in and see us. So how common is lymphedema? This is such a tricky question. It depends on so many things, inclusive of all cancers in the literature, 3% to 90%. Basically, the more extensive the surgery, definitely the more extensive or the more nodes that are taken out, the higher the risk of lymphedema. But there's a lot of other things that I'll talk about in a few slides. So when can lymphedema happen? Most common, and I apologize, but most of the literature, a lot of the literature out there is related to breast cancer. The same type of information can be applied to other cancers though as well in general. So in breast cancer, within the first 12 to 20 months, so for first 1 to 2 years, most lymphedema occurs. This graph, all it's really showing is us on the x-axis down here. This is months following surgery. So from 0 months after surgery to 5 years after surgery. Within 2 to 3 years, or 1 to 3 years, is when most of the cases occur. The different color lines in the graph just talk about different number of nodes taken out, what kind of radiation you got, and all of these have very specific risks of lymphedema and rates of lymphedema, which is why it's hard to give it an exact number. So early signs of lymphedema. Patients often say my arm, my leg, my neck, my breast feel heavy, achy, full, fatigued, numb, tingly. But the important thing is that it's in the affected or at-risk area only, meaning if you had lymph nodes removed in your right groin, if your left arm feels fatigued, I wouldn't worry about it. But if your right leg, because you had right lymph nodes taken out, then that's something you need to be aware of. It's a little tricky too, because chemotherapy can cause tingling, but that's usually both sides. Nerve damage can also cause numbness, deconditioning can cause fatigue. So really feeling these symptoms in the affected areas only is what's important. I'm almost embarrassed to say, when I started doing this many, many years ago, we didn't know that these were early signs and symptoms. So even if people couldn't see that their arm or leg was bigger, and there was some swelling going on, we used to kind of put it under the rug, but now we know that these are really important symptoms, and it's really important that you guys know these. So risk factors, again, sorry, most of the research is in breast cancer, but there is some in other cancers I put below. Axillary lymph node dissection, which just means you've had more than approximately 6 lymph nodes taken out. And that is less common in early stage breast cancers than it used to be, because they have discovered that there's more shoulder and lymphedema problems with the more extensive surgery. So as long as the survival rate is the same, they're doing less extensive lymph node surgeries now. When you get radiation, you can have, an entire area, like an entire breast or chest wall radiated. You can also get regional lymph node radiation. And what that means is those lymph nodes that drain that area get radiated, and that may be causing a little bit more damage and affecting lymphedema. BMI greater than 30, meaning obesity, you're at almost a 4-fold risk of lymphedema. Infection in the affected arm or leg is also lymphedema. Can increase your risk of lymphedema almost 4-fold, I should say. The early swelling after surgery, in some studies that has shown to be predicted, can predict swelling, but in others it does not. Rural living, mostly because of access to healthcare, and sauna just because of heat. Endometrial cancer and melanoma, I put some other risk factors down here if that applies to you. So what can you do to reduce your risk? Again, I usually talk about this for a long time in clinic, so I'm kind of flying through it, but we'll give you some resources to look this up as well. So good skincare, avoid infection. So in the area, again, if you had right axillary lymph nodes removed, you want to take really good skincare, avoid cuts, all that type of thing, and the affected arm. Maintain optimal body weight. We know that weightlifting and aerobic exercise can actually not only reduce your risk of lymphedema, but if you do have it, keep it under better control when done correctly. Avoiding tight things on the unaffected area, because that can impede lymphatic flow. If you do have lymphedema, we stress that it's probably important to wear compression garments, but have that specific conversation with your lymphedema therapist. And lower extremity lymphedema, you want to avoid prolonged standing, sitting, or crossing legs, because that can also put pressure on the tissues and impede flow. The National Lymphedema Network is a phenomenal network out there. I put the website here on the bottom on position papers, and this is what they call their healthy habits. So it's things that I just touched on in a looks much prettier than mine, on things that you can do to reduce your risk. And a few years ago, I had made this for some patients, and then we actually went forward and got it published. This is an action plan, essentially things that you should do in the green light to minimize your risk. The yellow light is if you have signs and symptoms, what should you do? And the red zone is, or the red light is if you have an infection. I will tell you to go to see your doctor. If you come in to see me and I think you have an infection, I will send you away and tell you to go see your doctor, just so they can get you on antibiotics and reduce your risk of swelling. We know that lymphedema therapy can reduce your risk of chronic lymphedema. In this one study, they randomized over 1,000 people into 3 groups, either no education or PT, education about lymphedema, or education and physical therapy. I should say lymphedema therapy. Sorry, Carrie. We know that the women that got education and lymphedema therapy, only 7 to 8% of them had lymphedema 2 to 3 years out, versus 15 to 18% in the other groups. So us educating about these risk factors plus seeing a therapist can significantly reduce your risk of chronic lymphedema. This is after an axillary lymph node dissection, so more nodes out. People that got treatment, only 7% of them got chronic lymphedema a year after surgery. And this represents a 28% increased risk of lymphedema in the people that did not get any treatment or education. There was a new study that came out just this year where they showed early use of a compression sleeve for 3 months after breast surgery versus not. And really all this shows, you want to just see that the blue line is compression and they're less at risk for having lymphedema versus the red line, which is usual care. There was also a trial with that fancy SOZO machine that you stepped on that kind of looked like a scale, or the bioimpedance, I called it. They looked at 1,200 breast cancer patients in 10 sites at the US. They were either they got measurements before surgery, and then they were either put in a group with the SOZO, the bioelectrical impedance, or they used a tape measure. They were followed up about 2.5 years, and what they found was the progression to chronic lymphedema was much less in the LDEX group. And that's mostly because that is very sensitive to tissue fluid changes. So it was able to detect changes in that interstitial fluid, which may represent or likely represents early onset of lymphedema. So that, again, the take-home message is that the earlier we can treat it, earlier you can spot it, usually the better we can treat it in the earlier stages. This is a little bit old. This is about 10 years old, but it really struck me. Oops, and I have a typo up here. Cost to screen women for lymphedema plus early stage treatment, only physical therapy, not doctor's office, was a little over $600. But later, if people presented with later stage, so stage 2, stage 3 lymphedema, that's not easily reversible, it cost over $3,000. That is a huge price difference, right? If we catch you earlier, it's less work for you. And definitely less expensive, among other things. Women that change their lifestyle to reduce lymphedema risk feel better educated about their risk and how to reduce their risk. They feel more confident in their ability to follow those strategies, and they have less emotional distress. Kind of seems like a win-win, which is fantastic that they're promoting this seminar for you. So take home messages. If you experience symptoms, even if you can't see swelling, go to a certified lymphedema therapist. With early detection and treatment, we can reduce the risk of lymphedema progression. And we know at this point, there is no cure. So prevention and early detection are our best options. I wanted to end this on a quote, another quote from a patient I have currently. The thing I love most about my lymphedema practice, yes, I think of it like a yoga practice, is that it's so simple. Motion and massage, specific exercises and stretches. These are tools that have radically transformed how I feel in my body. This is a power that every patient can have. So I urge you to ask questions, ask your doctors, be your own advocate. Don't let yourself be treated just like one size fits all. Everybody's risks are different. Go see a certified lymphedema therapist if you have any questions. And on that note, I will pass it on to Carrie.
Thank you. That was fantastic.
Thank you. Let me figure out how to not unshare that, or to unshare this. Oh goodness. I did this earlier. Oh, here. Sorry about that. Here you go, Carrie.
Good for me. All right, I'm sharing. You can see my screens now, right?
No, Renata, we for some reason see your laptop screen.
Okay. Hang on. Apologies, everybody. Technology. View.
Okay.
Oh, there we go. Good.
All right. Oops. Okay. So I'm going back. My name is Carrie. I'm an occupational therapist. I've been doing OT for 30 years, and I've done lymphedema for 25 of those. So I get to talk about treatment, and I want to start by just saying there's the intensive phase of treatment, and then there's also going to be this maintenance phase of treatment. And there are people that can just jump right into that maintenance phase of treatment. They come in very early in their swelling. But if you have a lot of swelling, and we get legs that are very large, and so those people really need to do a lot of therapy, and we can see them every day sometimes. And so we're going to go through the components of lymphedema therapy here, and we've got the bandaging, lymph drainage, that's kind of the massage, and we're going to go through all of these components individually too. So I just wanted to give you a heads up. It's compression garments, exercises, skincare precautions, which Renata touched on, the patient caregiver instructions, and then the treatment part of it. But again, some will be intensive and some will just be able to really move into the home program. So we're going to talk a lot about the home program too. So the goals of our therapy are to make sure that we're reducing the volume, but we also want to soften fibrosis. So fibrosis is when that tissue gets hard. And some people, their swelling doesn't get big, their swelling is just hard. Again, the skin gets hard. And one of the tests that we will do to see if people are swelling is to kind of lift their skin. How elastic is that skin? The proteins that are part of this fluid, right? If you've ever had a blister, it fills with that kind of clearish fluid. Well, those proteins that are in there are your immune system, and they're supposed to attract all the cell waste, virus, all the junk in your system will attract itself to these protein molecules. And when it's not circulating well, it can start to get harder and firmer. And so that is fibrosis, and we want to soften that and make it better. By doing all of this, by just increasing the circulation, then your risk of infection reduces. And then also people want it to look better. I don't know if insurances care as much about that, but that would be probably most people's goal. And then the ultimate long-term goal is to be able to take care of it on your own at home. And then an old study showed that we can reduce, it used to be just a lot of large swelling when I started in this career. And then the research was showing that we could reduce the limb by about 59% of its swelling. So we'll go into the effects of external compression. One thing we do for swelling is we provide compression. And that's going to help support the skin. And so then as we exercise with compression on, there was a study that just came out, and it said, if you are exercising with compression, then those muscles are pushing up against that compression and that fluid is moving up. And they did studies to see people who exercised with compression noticed a reduction in their limb after exercise, and people that exercised without compression, it may have gotten worse or may have stayed the same, but it didn't reduce. We've always known that muscle pump kind of helps push that fluid back up, but especially if you get that compression, because that skin will just stretch otherwise. So when you get them together, they start really pushing fluid back up. And it'll help support the veins. So compression bandages. We use 100% short stretch cotton bandages. This is my bandage here. This looks like an ACE wrap. A lot of people call them ACE wraps, but the difference between this and an ACE wrap is that it's 100% cotton. It only stretches this far. An ACE wrap will have a lot of elasticity in it, and it will really stretch. And sure, you can put that on for compression, but you can't get the pressure perfect every time you put it on. So what we can do when we wrap people with these bandages is pull the pressure just so that we get the pressure absolutely perfect. And then we get it so it's tighter at the end of the limb than it is here, than it is here, than it is here. And it's pushing that fluid back up. The people that need the intensive phase, they're in these bandages 23 hours a day. Here's my pictures. This is an arm bandage. So you can see it's not just the bandage. It's not one bandage. And then they take that off for their shower. And then we put it right back on, because one day you shrink this much. And if I go without, it just comes right back in. So one day this much, the next day this much, the next day, and we want to get a person as small as they can get. And then we go into the garments. Here's I got rid of my leg bandage. I had a leg bandage picture. So this is the manual lymphatic drainage. This is the massage technique. So I've got a picture here. Yeah. This is kind of a cross section of the lymphatic vessels. You can see the muscle and then some skin, and then they blow that up one time in one of those boxes. It shows how the green, that lymphatic capillary, is in the skin. And right, we just talked about how that fluid is in the skin and it can make that skin really change. So in the box next to it, you'll see that capillary, and they put these filaments on that capillary, and those filaments kind of sense when they're swelling, and then they open up, and then they'll close up when it's on the inside. But when they're swelling, they're kind of flailing in there, and they're not really doing their job. So when we come and we stretch that skin just as light as we possibly can, we are creating that fluid to go through the skin level, but we're actually creating new pathways for that fluid to move. I always think if fluid is really, down in the toes, it needs a lot of compression to make it back up to your body. But when it's around the breast, you can't get really great compression around the breast. Head and necks, it's hard to get compression there. And so the lymph drainage really works beautifully on those areas. But also, it's just part of that home program. We teach patients how to do this. This is another picture of those tributaries that Renata was talking about. And you can just see how if a protein ends up on that one side. Well, what we're trying to do is to kind of trick the body into not going to the lymph nodes that it wants to go to, but through the skin, we can move it across to that other watershed. So we're trying to take it over to the lymph nodes that are functioning, to a different tributary, and that's how we're using that lymph drainage. Now the exercises are similar to that lymph drainage. When you stretch that, remember I just talked about how lymph drainage is stretching the skin on very, very light. It's a light technique. So when we do exercises, we want to stretch skin. If I'm trying to move fluid this direction, I stretch that skin and then I contract it and I stretch it again. That is kind of how our exercises. So our exercises are not hard to do. They're very specific to swelling, however. So this is what Renata had already talked on too with skincare precautions. Just taking good care of your skin. Every time you get a cut or a scrape, it sends this response down to that area that's painful, any pain response. And it says, oh, let's send more fluid down there to try to heal it up. So more fluid starts moving down there to heal this stuff up, and all of a sudden it's congested. Right? So you can go along without having any issues, but then all of a sudden, it could be a bug bite or it might be a hangnail. And it isn't that we want you to be so concerned with every hangnail, but we want you to know how to look for swelling and feel for swelling. Most people will feel swelling before they see it. So it's that throbby, achy, dull that Renata was talking about, but also you can look for it. I'm going to look at my my knuckles, and I'm going to, I've got peaks and valleys. I'm going to look at my feet. I'm going to want to see those bones and some tendons maybe, and I want to see contours, and I want them to look alike. And if they don't, if they look puffy or raised, or there's not as many contours, you can use a visual aspect. And then some people just have no clue on their swelling, and we are just like, you just have to measure. I'm going to teach you to measure, and you are going to come back and know when you are worse. And when you are worse, you're going to be taking care of this a lot more strict than you probably do when you don't feel those throbby jolts, especially if you're early days. Because again, swelling can kind of come and it can go. I know someone had mentioned a question about it being triggered years and decades later, and it can. It's not the norm, though. I think you saw with Renata's research. I did have someone that had some arthritis once, and it was 26 years after her surgery, and she did fine until a little arthritis. It was a pain response. And until we start asking these questions like, what is the trigger here? Like, why 26 years later did your arm get worse all of a sudden on her? But it was just a flare of arthritis. So then these are the other things. I think somebody mentioned too that their swelling was worse in the cold. Now the heat will make those vessels kind of dilate and then the fluid moves down. But the cold makes them constrict. And we really want these lymph vessels pumping fluid. So we don't want either the constriction or the dilation. But I would say a lot of my patients, it's more the heat that gets them. Vacations are a big time of flare for people when they go, it's air travel, it's that change in atmospheric pressure, air travel, their diet is different, a lot more salt intake. And then usually they're going to a warmer climate, but cold can be an impact. And so I don't have a better thing for you to do for it, but just to realize that that can be an impact for some people. Compression garments. Now, we don't use the garments to reduce a person. We want to get a person nice and small through other compression means. And then we're going to move into the compression garments. There are different classes of compression garments. There's nighttime compression. But we really, if I measure a person at this size and then we get them down, that won't fit them anymore, and it'll keep them at this. So the whole objective is to get a person small and then get them into the compression garments. And it can be compression socks, it can be compression arm sleeves, bras. I mean, they make them for the head and neck population, but those people want to sleep in. They will wear them, maybe around the house a little bit. But the garments have a lot of elasticity. And we just talked about how A-straps, you just don't get that pressure right. People will push into the compression socks. So typically in the long haul, the socks are not the only answer for swelling. They are good, they do support during the day. So you're not just getting everything to fill back into those limbs. But typically we use the socks during the day or compression sleeves. And then we still want to wrap stuff out at night, because that's our push of fluid when we can really wrap things out at night. And then I've got some samples of compression garments. There's a compression bra. These are some nighttime garments. So you've got, one's just a Velcro device and one's it's kind of a chip foam bag that people can sleep in, and it does help their swelling, their gradient. And then there are pumps. I like this pump because it's for the head and neck, right? That's the only one I think that makes it for the head and neck, but you can see to the other side, there's one for the arm and the leg, but a lot of companies will make pumps. Now, pumps are part of that home management program. Again, we don't necessarily use them as part of that intensive phase of treatment, but it's on your body for about 45 minutes. This one kind of mimics that lymph drainage. They say each pump kind of fills and then it stretches your skin a little bit, right? But then they do make the old-fashioned pumps where it's just really more of a high pressure, right? So more of that, it provides that compression, but they're only on your leg for about 45 minutes to an hour. And so you're getting that hour of help, but what happens the rest of the day is the really important part, because the second that's off, things are just refilling and quickly. So we do have some general contraindications for the treatment, and that's infections. If there's an infection, we stay off. There's no compression. You go see your doctor, get on the antibiotic, and stay off both the lymph drainage, and we don't want to move things, we don't want to move it around. Let the antibiotic do its work, and then we can come back to it later. If the heart's not handling the fluid with the congestive heart failure or the cardiac edemas, we don't want to push more fluid back up there. And then we don't work right on top of active cancer and arterial disease or blood clots. There are some surgeries out there. This is called, and I always preface this with, these are not great surgeries. These are for people. I have a cleaning crew out here right now, so I hope you can hear me okay. These surgeries are for people who don't want to bandage as much. They still need to be in compression garments. So what you will see on this picture is that they're actually reconnecting the lymph vessel that wasn't, moving into anything, into a vein, and then hopefully it'll just move back up to the heart. Be very careful of who you see to do these surgeries too. I think anybody can just hang a sign on their door that says, yep, I'm doing these surgeries, but you want to find someone that's well-versed in these. This is a lymph node tissue transplant where they're actually taking lymph nodes from another part of the body and moving them into the area that was affected. And what they used to do is they used to try to just take a lymph node itself with maybe some lymph vessels to it. And they said it's like wet toilet paper when they're trying to do this, and it'll just kind of disintegrate. And then they discovered that they could take it in the tissue and replant that. But we worry again about the amount of scar tissue that's happening to that area. And also we worry about the donor site. We don't know that you won't get lymphedema if they take lymph nodes from another area of the body. They think that they're getting an area that you're not using much. They'll do some testing to see how much, fluid is moving around, but they don't know for sure, I think. And then this is called suction-assisted protein lipectomy, and they're taking those proteins out, kind of like what's liposuction, but they're calling it protein lipectomy to kind of stay away and tell insurance companies that this is very different. It is that protein that we're trying to move out, not fat tissue, and it's that hard fibrosis from this swelling that they're trying to do. Those other surgeries, they call them super microvascular surgeries because of the fact that the amount of micro, they have to have so much magnification to be able to do those surgeries. And then this is not like typical liposuction. Don't go to a regular liposuction. They use a finer cannula or something, so they're not doing as much damage to the tissues. And again, I'd be very careful about who I was seeing. And Renata already put these, but I can't emphasize this is kind of our governing agency, and they came out with some position papers that are really good and really solid. So I've got some pictures of lymphedema. I wanted to say too, I'd forgotten this. I just thought of this today. There's a couple of medications that they're trying to come up with as usage for lymphedema. But I think that one was in studies, and I haven't seen where it's actually like approved yet for lymphedema. And that was about a year ago. It wasn't yet approved for lymphedema specifically. And then there's another active study that they're doing, but all they're trying to do, they're not trying to get rid of girth. They're trying to change that skin level softness. The first study they did actual skin biopsies to see how soft it felt. And then the other one, they're just doing like calipers to see how narrow that pinch gets, and like an ultrasound too, but it's all about that softness of the skin. These are just pictures of lymphedema. I had some leg pictures in there too, so I think I took those out. So this is our information. There were a couple of questions. One was just the stress of the lymphedema management and how to deal with it. And I think when you want to come to us, we've done it for so long that we do have ideas about. I mean, my patients that are young are wearing they like the black sleeves, and I'm like, oh, you guys you're so gutsy, but it looks more athletic. It looks more like kind of what the sports people are wearing. So we have little tricks on, I like this garment because of this, and I like this. And because we've done it for so long, we hear back from patients about what they like in that arena that can maybe trick or hide swelling. There's some websites that do shoes for people with lymphedema. And but honestly, it's hard. It's hard for everybody. And people, when I show them the bandaging, nobody wants to do bandaging, right? I was talking with someone, and they called it like the time toxicity that your medical care, especially after cancer treatment, takes. So I really liked that. But when people get that bandaging on, it looks, it's hard to walk in, people can fall, but it feels like a hug. It doesn't feel like tight pressure. And so I'm always encouraging people, just come in. What we want to do is give you a toolbox of these items and then send you on your way with this toolbox, because you're going to be the one that manages it in the long run. And I'm a big fan. Everybody hates bandaging, but I'm a big fan of the bandaging, because if you keep that, when you get the bandages off in the morning, your leg or your arm feels fresh and it moves really well. And so that those compression devices are there to help your leg really get down, so you can do the things that you want to be able to do. So I think that is my take-home message, is just to learn it all now before it gets harder to learn it, right? As we age, we just know that these things kind of really get worse. They don't get better on their own. So come in early is, again, probably the last thing I would like to say. All right, I think I'm finished.
Well, thank you so much, Renata and Carrie, for such great content. We learned so much about just lymphedema and how to manage it, and some very helpful tips. So thank you both. And so before we move on to some questions, I wanted to let you all know that we will be sending out a survey that will be emailed following today's session. So please don't forget to do that for a chance to win a swag bag. So we've had quite a few questions come through during your presentations, so we can just start going through some of those questions. So I see a question here about activity and exercise. How is it done correctly? This particular attendee noted that I am getting a flare-up of lymphedema post-exercise. So whichever one of you want to take that on.
Carrie, do you want to, either one of us is fine. And
Go ahead, Renata.
well, I guess my question, and I'm not sure if the person, you said the person is not wearing compression during exercise.
Didn't note anything about
You didn't
that.
note anything. Okay. If you have lymphedema, at least when I start treating and working with people, highly, highly, highly suggest wearing compression during exercise. And Carrie, feel free to chip in anything.
Agreed.
Like Carrie was saying, I always say it's almost like squeezing a ketchup bottle, you know, like if you have the compression on one side and then the muscle contracting on the other, then the fluid on the other side will come out just like the ketchup. I have a lot of food analogies. So the compression really, really helps you get rid of that fluid. And because when you're, let's say you're exercising, you're doing weights, you're bringing more fluid into that arm or that leg. That's an increased lymphatic load. So if your body can tolerate that amount of load, you know, the amount of load will go up, you'll have no swelling because your body, your lymphatic and your veins can get it out. But if that's more than your threshold, then you really need that compression to really help push it back out, or else you're going to kind of like a clogged sink, get a little bit of fluid and it's going to stay there. We know that aerobic and resistance exercise can both help reduce fluid, just like Carrie was saying also. Carrie, what else would you say? Anything else you'd want to add?
Yeah, just there is a specific strength. There was some research on strength training, and they do recommend that it's not the typical strength training where you go into that high fatigue with those kind of building that sore muscle type thing. They want to keep you down just a little bit on the resistance. So it's more reps. I always have to think of more reps, lighter weights, but they want you to build it. They want you to get nice and strong over time. So that's not the problem, but to kind of back it off so you're not just doing, because every time that you lift those weights and the muscle starts to get that soreness to it, you know, you're kind of ripping that open and creating that healing response. And of course, there's more fluid and it flares. So if we can just back off a little bit but gradually pick it up a little bit at a time, then that can really help you in the long run be able to do whatever you want to do and being consistent, right?
Mm-hmm.
Yeah, and I'll say too, when I started, and probably Carrie, when you started doing this also, it was like, oh my gosh, don't like do, you know, don't rock climb, don't do anything ballistic, don't like tennis, don't hit over a tennis racket. And that's not true. People dragon boat racing, I have people doing marathons, I have people doing triathlons, I have people that are Olympic weightlifters, right? You just need to know your symptoms. And like Carrie was saying, start with now I'm getting it mixed up, high rep, lower weight. And then let's say you do a workout, like, oh my gosh, my arm or my leg did great. I didn't have any more swelling. Okay, well, your body handled that. Well, the next time, if you want to bump it up a little bit, the reps or the weight, or the amount that you're walking or running. How did my body do with that? Swelled a little bit. Okay, well, this week, that was too much for me. Back up, back down. And talk to your lymphedema therapist, because maybe there's something that you're missing too.
Good point. Thank you both for that. So what do you think about KT tape for lymphedema? This particular attendee said, my lymphedema PT used it on me and it felt like it was very effective and less annoying than the compression sleeve. So thoughts on that? Again, Carrie or Renata, whichever one of you want to take that on.
I use a lot of
one.
Huh?
I said, you want to go first on this one?
I would be happy to. Yeah, I use a lot of kinesio tape. And again, it's part of that tool bag. If you feel like it really helps you, then please use it. I don't like to use the same strip in the same place because I think your skin can start to get aggravated from that adhesive. And even though you're not allergic, it can still kind of make some redness, and then it's a healing response again. And I I don't know you, so I won't say take the sleeve off and just do kinesio. You know, I don't know if that works for you, but when I use kinesio tape, I'm like, you guys, if it works on you, you kind of know, like we will feel right where this tape is. You can feel that skin is better where it isn't. And if it doesn't work, people, you know, we're like, oh, well, we tried, but it either like kind of works great or it doesn't. And then we tried. So, I mean, I like it. I don't think there's big studies about using kinesio tape for swelling.
I'm not sure on that one. I haven't really looked at it.
One, I think, but it wasn't huge. Yeah.
Yeah. And I'll say I'll agree with Carrie. I have some patients that it works fantastic. Like, oh my gosh, I could totally feel the fluid working. And then other people, same day, next patient is like, yeah, that didn't do anything. Right.
Yeah.
So you just got to try it. And it's great if you have another tool in your toolbox.
All right. So more questions are coming through. So have you seen a connection between secondary lymphedema in lower extremities and prolonged treatment, for example, a brain tumor? So surgery, radiation, and multiple chemotherapies, and no lymph node removal.
Can I start on this?
Please.
I think, you know, in the field, I hear the experts talking. I don't think there's research on this, but I think there's kind of a fine line between primary and secondary lymphedema. Primary is where you're kind of born with it. It doesn't have to show up right away, but you know, by the time it's the average swelling that you're seeing when you're walking around, like that guy's got swollen, you know. So swelling happens, right? And I think when you start to shake people out a little bit, if you have a little underlying swelling, my fingers swell when it's really hot in the summertime. When I'm on an air travel, my ankles get swollen. Those little things are little signs that happen over the course of the life. And then there's an incident, a medical happening here. And it can be brain rate, you know, my guess is that you're not as active. And when the activity lessens, then maybe you're just getting some of these aging type, you know, swelling. I don't know that it's from the radiation and the treatment in the brain, but I think less activity, probably, you know, different diet, more sitting. Those things contribute in what I see to like people come in with leg swelling often that shouldn't have leg swelling, you know, according to their medical. Renata, anything?
I don't know that I have anything to add to that. Yeah, well said.
So there's another question about just flying, so long flight. So this particular attendee said, my lymphedema post-axillary lymph node dissection was originally triggered by an overseas flight. I am going to New Zealand next year and wondering if there's things to do during the 14-hour flight to prevent, help prevent exacerbation. I do wear compression sleeves.
I actually just spoke with a patient on this who's traveling to Europe less than a week ago. So I think definitely make sure your compression sleeves are recent and they fit well. You want to make sure, some people feel like, well, I'm just not going to drink any water. I don't want to become like bloated. I don't want to, no, we actually want you to drink water. We want you to, as Carrie mentioned, avoid salt. And a lot of the plain food is high salt, preservative, you know, whether you bring your own, you make healthier choices. That's something that can help. Also, when you drink a lot of water, you're gonna have to get up and use the bathroom. As much as we all hate airplane bathrooms, you know, we'll have to get up, and that's movement, right? And that movement is going to be lymphatic pump. Then you have your compression on, so that's going to help too. And then I always tell my patients that when you're sitting, you know, let's say if it's in there again, because I treat mostly upper extremities at this point because of my PhD, but squeeze your hands together, make fists, roll your wrists, bend and straighten your elbow, kind of stretch, right? No one's going to know what you're doing. You're in a long flight. So the more, it's another way that you can just remind yourself to move and use that, stimulate that lymphatic pump to get that fluid out. Carrie, what else you got? I think that's.
I'm a big fan of pack those bandages. This is the specific time you want that tool, and everybody hates to pack the bandages. And practice it right before you go, because you don't want that to be the thing you remember about your trip, right? It kind of ruins your trip for you. And also when you get there, I love pools. Pools have a natural compression to them. So get in that pool and kind of cool off. And most of your hotels will have that, but pack and just wrap at night. You don't have to wear them all the time, but it will even if you never touch them, if you don't have them, you'll all the time, you'll be like, I should brought my bandages. Like I would be feeling so much better right now. So pack. Don't touch them if you don't need them, pack them. I have a strong like love of bandage.
So we have just time for one or two questions. So can I get a compression sleeve on my own? Where? Or do I need to see an OT for a fitting?
So they are online and you can get them, but I don't recommend doing that without someone taking measurements. The stuff I see coming off of Amazon, more compression socks, I think, coming off of Amazon, and I'm like, you guys, you didn't even measure, like you took a shoe size, like what is that? So I highly recommend you get measured, and then there are fitters you can go to, and most of the time you do need a doctor's order, but usually you just call your doctor and say, I'd like to get a compression sleeve, and they kind of, if you have it's usually oncology, they kind of throw those orders in pretty nicely sometimes.
Okay. So I'm looking at some of the other questions that have come through. Okay, I know you kind of brought this up, but I think maybe it would be helpful to discuss this a little more. So how would you advise a teenager fighting cancer with additional stress of lymphedema management?
I put some thought into that. So again, the psychology part of it, like go see a counselor first of all, because that's just a really hard thing. But making this leg, I think it's leg swelling. I'm not sure. But if it's leg swelling, making it look like leggings a little bit, or trying to come up with ways to trick people into not knowing what's happening, right? And then I do a lot of bandaging at night. And I'll tell people too, if you want to go to an event for like an hour without compression, well, just wrap that night, get that fluid that all filled in during the day. So if there's an event, there are ways to trick around it, but you gotta make up for it on the opposite end.
And the only thing I'll add to that too, which I think is the first thing you hit with support, is that there's so much online support. There's so much like Gilda's Club. There's so many groups where you can, gosh, I have people that have, have told me they're in Facebook groups, right? So you can find a Facebook group or meetup group for anything. And so just finding other people that get it, finding other kids that get it and can understand it. That might be able to give you some tips like Carrie was saying, or that might just be good to be like, you feel like you're not alone and like, oh my God, that person gets it. And that is just such a load off. It's the only other thing I would add to that.
No, that's great. I think, unfortunately, we are going to have to leave it here because we're out of time, but huge thank you to Carrie and Renata for being here today and answering these questions that have come through. So as a reminder, the recording from today will be available on our website by the end of this week. You'll also receive an email tonight, as I've mentioned, with a quick survey to help us continuously improve. You can enter to win a swag bag of all new stuff when you complete the survey. So we look forward to seeing you all next year, next week, where we will be hearing from Dr. Thyra Fossum, who will be talking about a very important topic of sleep hygiene. So we're so excited to hear more from her. But thank you everyone for joining this evening. Have a wonderful evening, and we'll see you all next week.
Thank you so much.
Thank you. Bye now.
Bye.